In this section, we will explore how the delay in building a new hospital for St. Helier, one of the 40 new hospitals promised by Boris Johnson, is affecting patient safety and staff morale in the existing dilapidated buildings. St. Helier Hospital is one of the busiest and most underfunded hospitals in London. It serves a population of over 500,000 people in South London and Surrey. Some of its buildings predate the NHS itself and are plagued by leaks, floods, sinking foundations, faulty windows, and inadequate space. The hospital's chief medical officer, Dr. Ruth Charlton, has warned that patient safety could soon be at risk unless the replacement for St. Helier Hospital is finally confirmed by ministers. She said that they are delivering safe care now, but it is not easy in such a dilapidated and unpleasant environment, and they fear they won't be able to provide the level of care they should for much longer. She gave examples of the challenges they face every day, having to move a wall because the foundations were sinking and gaps were appearing, having to replace windows at risk of falling out, having to vacate parts of the hospital due to flooding and leaks, having to close a ward because the lift was not working, having to cope with stifling conditions in the summer due to lack of ventilation. She said that every day they wait costs money, and each year they have to spend more and more on updating their old, run-down buildings, diverting scarce resources from the front line. She said that there is no other option than to build a new hospital and make improvements to their existing sites. The government had pledged to build a new hospital in Sutton to open in 2025 as part of its promise of 40 new hospitals across the country. However, the project has been delayed by at least 2 years due to planning and funding issues. A minister has given assurances that the government is committed to building the new hospital despite the delays, but no concrete date has been given. The delay in building a new hospital for St. Helier has left patients, doctors, and nurses frustrated and angry. They feel let down by Boris Johnson's broken promise and wonder how long they have to endure the crumbling conditions of their current hospital. They demand urgent action from the government to deliver on its commitment and ensure patient safety and staff morale are not compromised any further. One of the most controversial aspects of Boris Johnson's promise to build 40 new hospitals by 2030 is the definition of what constitutes a new hospital. According to the government's own documents, many of the projects are actually refurbishments or extensions of existing facilities, not new constructions. This means that some of the hospitals that are supposed to benefit from the program will still have to deal with aging and crumbling buildings that pose a risk to patient safety and staff morale. For example, St. Helier Hospital in South London, which was visited by Johnson in 2019 and included in the list of 40 new hospitals, is actually only getting a partial replacement. The plan is to build a new facility on a nearby site that will house some of the acute services, such as A&E, maternity, and intensive care, while other services will remain at the old site or be transferred to Epsom Hospital. However, this plan has not been approved by the government yet, and the trust that runs the hospital has warned that it faces constant ward closures and flooding in its dilapidated buildings. Another example is Whipps Cross Hospital in East London, which was also visited by Johnson in 2019 and promised a new hospital. However, the project only involves replacing about half of the existing buildings, while the rest will be refurbished or demolished. The trust that runs the hospital has said that it needs £55 million a year to maintain its aging estate, which suffers from leaks, asbestos and fire safety issues. The government's definition of a new hospital is vague and misleading, and does not reflect the reality of what many of the projects entail. The public deserves to know the truth about how much of their local hospital will actually be rebuilt or renovated, and how long it will take. The government also needs to provide adequate funding and planning permission for all the projects, otherwise it will fail to deliver on its flagship NHS pledge and leave patients and staff in unsafe and unsuitable environments.